And good evening, everyone. I'm Brian Allen.
I'm Andrea Anderson. The world is moving forward in the wake of the COVID-19 pandemic. The World Health Organization announcing last week that COVID-19 is no longer considered an international public health emergency.
Well, tonight we're taking a look back at the effect of the pandemic in South Dakota. Beth Warden caught up with one man who was an integral part of public health messaging in the state. It is our 6 o'clock top story tonight.
I declare COVID-19 over as a global health emergency.
With the announcement from the WHO comes a time to look back on the last 3 years. Dr. David Bassel never envisioned a major pandemic in his career. Then came the 2009 H1N1 swine flu.
And I thought that was going to be the biggest pandemic I'd ever see during my career.
But that was nothing compared to the COVID-19 pandemic.
March 10th, 2020, I remember that very vividly.
Bassel joined others for a COVID-19 planning meeting. The team thought the first case could be weeks or maybe months away.
And it was during that meeting that we got the call that the first case had been seen in a Avera hospital. And all of a sudden, this just got real.
Seeing communities coming together was heartwarming.
Church groups that were, had sewing clubs that came together and started making handmade masks. Everybody just came together and worked together so well, and then the public, came together, and it was just one of the things I think I'm going to be the most proud of in our career was how that was handled.
Avera, the state, and other systems worked together for the day when the vaccines arrived.
When we get the vaccine, it's going to be limited amount. How do we allocate it? Who do we start? How do we get as many people through as quickly as possible? How do we track everything?
Looking forward, future variants may need to be addressed. Some who survived COVID face an uncertainty of long-haul COVID symptoms.
This virus is here to stay.
We still have, over 20 patients in the Avera hospitals that are COVID positive right now. And so it's not like it's gone totally away. And it's just something now that's part of the normal way that we do business.
In Sioux Falls, Beth Warden, Dakota News Now.